Ever wonder why an anesthesiologist is so crucial to your surgical experience? It's because this medical professional plays a key role in your journey through surgery. They are not just the ones who put you to sleep and wake you up. Their job extends far beyond that, ensuring your comfort and, most importantly, your safety. An anesthesiologist is like the conductor of an orchestra, managing a symphony of vital signs like blood pressure, heart rate, and breathing. They monitor these signs throughout your surgery, making quick decisions to keep everything in harmony. They also help manage your pain during and after surgery, and they're specialized in understanding how anesthesia will interact with your unique body chemistry. They're the unseen heroes of the operating room, tirelessly working behind the scenes to ensure your surgical experience is as smooth and safe as possible. So what should you ask your anesthesiologist before going under the knife? Firstly, always inquire about your anesthesiologist's experience and qualifications. In the world of healthcare, experience and qualifications are crucial. These two elements often determine the level of competence and, ultimately, the safety and success of your treatment. It's no different when it comes to your anesthesiologist. Now you might be wondering, why is it so important to know about their experience and qualifications? Well, the answer is simple. Anesthesia, while routinely administered, is not without its risks. Complications can arise, and when they do, you want to be certain that the person responsible for your anesthesia is well equipped to handle them. An experienced anesthesiologist will have encountered a myriad of situations and will be well prepared to deal with any unexpected turns. Their qualifications, on the other hand, are a testament to their knowledge and skills. It's a combination of years of rigorous training, continuous learning, and a commitment to excellence. It's essential to remember that this is not an interrogation, but a part of your right to informed consent. You're not questioning their ability, but ensuring your own peace of mind. After all, they will be the ones guiding you safely through the process, from the moment you drift off to sleep until you wake up in recovery. So, when you meet your anesthesiologist, don't shy away from this question. Ask about their experience, their qualifications, and anything else that will help you feel confident in their care. Remember, it's your life on the line. You have every right to know who's in charge. Next, ask about the type of anesthesia you'll receive. This question is critical to understanding your anesthetic plan and setting your expectations for the procedure. There are three main types of anesthesia: local, regional, and general. Local anesthesia numbs a small specific area of the body, allowing you to stay awake and comfortable during a minor procedure. Regional anesthesia, like an epidural or spinal block, numbs a larger area of the body while you remain conscious. General anesthesia, on the other hand, affects your whole body, and you'll be completely unconscious. The type of anesthesia used depends on several factors, such as the nature and duration of the procedure, your overall health, and even your preferences. For example, a simple skin biopsy may only require local anesthesia, while a more involved surgery like a hip replacement may require general anesthesia. Knowing which type of anesthesia you'll receive can help you prepare mentally and emotionally for the procedure. It can also guide your questions about the risks and benefits associated with that specific type of anesthesia. For instance, local anesthesia carries fewer risks than general anesthesia, but it's also used for less complex procedures. It's important to have this discussion with your anesthesiologist. They can provide detailed information based on their expertise and understanding of your specific situation. Remember, no question is too small when it comes to your health and well-being. Knowing the type of anesthesia can help ease your anxiety about the procedure. Thirdly, always ask about the potential risks. Now, it's important to remember that anesthesia, like any medical procedure, comes with its own set of potential risks. Yes, they are generally safe, but there's no such thing as a zero-risk procedure. It's like crossing the street. You look both ways, but there's always a tiny chance that something unexpected might happen. The risks can range from mild to severe. On the mild end, you could experience nausea or vomiting, a sore throat, or muscle aches. More serious risks could include breathing difficulties, allergic reactions, or even very rarely brain damage. Some factors that might increase these risks are personal health conditions, such as heart or lung disease, obesity, or smoking. But don't let this scare you. Remember, these risks are very low, especially when your anesthesiologist is highly trained and experienced. This is exactly why it's crucial to have these discussions with your anesthesiologist. They can explain how they plan to mitigate these risks and can adjust their approach based on your personal health history. By knowing the potential risks, you're not only empowering yourself with knowledge, but also helping your anesthesiologist provide the best possible care. So, don't shy away from this question. It's not about fearing the risks, but understanding them and working with your medical team to minimize them. Knowing the risks can help you make an informed decision about your procedure. The fourth question to ask is about post-surgery pain management. This is a crucial question because it directly relates to your comfort and recovery after the procedure. The type and extent of your surgery, your overall health, and your personal tolerance to pain are all factors that can influence how much discomfort you may feel. Anesthesia plays a significant role in post-surgery pain management. General anesthesia can reduce your awareness of pain during the procedure, but once it wears off, you might experience some discomfort. This is where effective pain management comes in. Your anesthesiologist and your surgical team will work together to create a pain management plan tailored to your specific needs. This could involve medications like opioids or non-opioid analgesics, or techniques such as nerve blocks or epidural analgesia. It's important to remember that everyone's pain experience is unique. What works for one person might not work for another. So, it's essential to communicate openly with your anesthesiologist about your pain levels and any side effects you might be experiencing from the pain management treatments. The goal of pain management is not just to minimize discomfort, but also to help you get back on your feet more quickly. Proper pain control can allow you to start moving sooner, which can speed up your recovery and reduce the risk of complications like blood clots or pneumonia. A good pain management plan can significantly improve your recovery process. The fifth question involves your recovery period. This is the period immediately following your surgery, when your body is healing and you're regaining your strength. It's important to know what to expect during this time. Anesthesia, while an essential part of many surgical procedures, can have side effects that you may experience during your recovery. These side effects vary from person to person and can range from mild to more serious. Some common side effects include nausea, dizziness, and confusion. These effects are usually short-lived and subside as the anesthesia wears off. In addition to the side effects of anesthesia, your recovery period will also involve managing any pain or discomfort from the surgery itself. Your anesthesiologist, in collaboration with your surgeon, will have a plan in place for this. Pain management may involve medication, physical therapy, or other approaches depending on the nature of your surgery. There's also the emotional aspect of recovery. It's not uncommon to feel a bit low or anxious after surgery. This is a normal response to the physical stress your body has undergone, and it's important to take care of your mental health during this time. Lastly, your recovery period will involve gradual reintroduction to your normal activities. This should be done under the guidance of your healthcare team to ensure you're not pushing yourself too hard, too soon. In conclusion, your recovery period will be a time of healing, both physically and emotionally. Understanding your recovery process can help you prepare for it. Finally, you should ask how you can prepare for the anesthesia. Preparation is a crucial step that can significantly reduce the risks associated with anesthesia and improve the overall surgical experience. First and foremost, you'll want to provide your anesthesiologist with a complete medical history. This includes any allergies, medications you're currently taking, and past experiences with anesthesia. This information will help your anesthesiologist determine the best anesthetic plan for you. Next, it's essential to follow any preoperative instructions your anesthesiologist or surgeon may give you. This often includes fasting instructions, such as not eating or drinking anything after midnight the night before your surgery. Following these instructions is crucial, as it can reduce the risk of complications during and after your procedure. In addition to these physical preparations, it's also important to prepare mentally. Understand that it's common to feel anxiety before undergoing anesthesia and surgery. If you're feeling anxious, let your healthcare team know. They can provide you with resources to help manage these feelings, ensuring you go into your procedure as relaxed and comfortable as possible. Finally, don't be afraid to ask questions. The more informed you are, the better prepared you'll be. Remember, your anesthesiologist is there to help you through every step of the process. Proper preparation is key to a successful surgery and smooth recovery. In conclusion, these are the 6 questions to always ask your anesthesiologist. First, ask about their experience and qualifications. This helps you to gauge their competence and trustworthiness. Second, inquire about the type of anesthesia you will receive. This will help you understand the process and manage your expectations. Third, ensure to ask about the potential risks associated with the anesthesia. This knowledge will help you make an informed decision about your health. Fourth, discuss how your pain will be managed after surgery. This prepares you for the post-surgery experience and helps with your recovery. Fifth, ask about what you can expect during the recovery period. This gives you a clear picture of the post-operative journey. And finally, sixth, ask how you can prepare for the anesthesia. This enables you to take an active role in your healthcare. Remember, your safety and comfort during surgery largely depend on your anesthesiologist. Never hesitate to ask these questions.